A healthy diet is an essential part of diabetes management, helping to control blood glucose levels and achieve a healthy weight. It is important that dietary advice is tailored to your individual needs and is specific to your type of diabetes. In type 1 diabetes, in combination with a healthy diet, you may be taught how to use a carbohydrate counting system to allow more flexibility in eating by matching your mealtime insulin with the carbohydrate eaten. Your diabetes specialist will discuss this in detail with you. In type 2 diabetes, we recommend a balanced healthy diet, which includes low glycemic index carbohydrates. The diet recommended for people with diabetes is suitable for the whole family. Some people will be trying to lose weight. Others will be trying to maintain their current weight. The following diagrams show the proportion of each food group in a typical meal, depending on your circumstances. In the following sections, we will talk in more detail about various parts of a healthy diet. Carbohydrates include both starchy foods and sugary foods. All carbohydrates will have an effect on your blood glucose level, even if they do not taste sweet. All carbohydrate foods are broken down into glucose by the body. Some carbohydrates are broken down slowly, others quickly. The speed at which they are broken down is known as the glycemic index. The quantity of carbohydrate eaten and the glycemic index will determine the effect on your blood glucose levels after food. Carbohydrate foods include breads, cereals, flour, pasta, rice, couscous, potatoes, crackers. Some vegetables and legumes such as peas, sweet corn, sweet potato, lentils, pulses. Fruit, fruit juice, and dairy products. Cakes, biscuits, honey, sweets, chocolate, fizzy drinks, cordial. Most carbohydrate foods have now been tested for their glycemic index, or GI. The glycemic index of a food can help inform you how quickly the glucose in the carbohydrate is released and the effect it will have on your blood glucose levels. People with type 2 diabetes are recommended to try and choose carbohydrates with a low to medium GI, less than 55. The speed that your blood glucose level rises is slower with these foods than with foods with a high GI. Low GI foods can also aid weight loss, keep your blood glucose levels within the recommended limits, and reduce your cholesterol. High glycemic index foods are useful for treating very low blood glucose levels, known as hypoglycemia. This is because you need to increase your blood glucose quickly. Some examples of low, medium, and high glycemic index foods are high glycemic index, cornflakes, bagel, white bread, baked potato, watermelon, rice cakes, jasmine rice, table sugar. Medium glycemic index, muesli, granary or wholemeal bagel, rye bread, sweet potato, banana, basmati rice, milk chocolate, honey. Low glycemic index, porridge, cholent mix, dried apricots, cherries, yogurt, noodles, dark chocolate, fructose. Most fruit, dairy and soya products have low glycemic index. They make excellent snacks or the basis for a dessert and are full of vitamins and minerals essential for health. Other foods which have a low glycemic index, such as plain chocolate and ice cream, can be high in fat. These foods should be eaten with caution, as they have little or no nutritional benefit and are high in calories. Keep them for special occasions or for a treat. Some carbohydrates can be substituted to reduce the number of calories and the effect on blood glucose levels. Some examples are: substitute table sugar for granulated sweetener. Switch fizzy drinks and cordials for diet or no added sugar versions. Try whole grain or granary bread instead of breads with fine refined flour. Try to reduce cakes, biscuits, crisps, and instead try fruit or yogurt for snacks. Some fats are essential for a balanced diet, but much of the fat that we consume is not needed for our health. Eating too many fats can cause weight gain, increase your cholesterol levels, and increase your risk of heart disease. Also, if you carry extra weight around your waist, your body may be particularly resistant to diabetes treatments. We all need to reduce saturated fats and high-fat foods in our diet. Some examples of foods to cut down are cheese, full-fat milk, cream, red meat, chicken fat, schmaltz, cakes, biscuits, butter, margarine, oil, mayonnaise, and pre-packed foods. To reduce your fat intake, take the skin off chicken, trim all fat off meat. Grill, bake, or steam instead of frying. Choose skimmed or semi-skimmed dairy and soya products and cheese. Reduce high-fat snacks such as crisps, nuts, cakes, and biscuits. Use mono or polyunsaturated oils and spreads based on rapeseed, sunflower, or olive oil in small amounts instead of butter and solid cooking fats. Omega-3 fats are recommended in the diet. They contain essential fatty acids. They are found in oily fish, fresh or canned, such as herring, kippers, mackerel, salmon, sardines, and pilchards. Try to have at least 2 portions per week. Protein is an essential part of a balanced diet. They contain essential amino acids. They are found in meat, fish, eggs, milk, and dairy products, soya, and pulses. Meat, fish, and eggs contain no carbohydrate, so have no effect on your blood glucose levels. Dairy products, soya, and pulses contain some carbohydrate, which is usually low glycemic index. Protein foods can contain fats, so try to choose lean meats, skimmed or semi-skimmed milk and dairy products, and try to keep to the recommended portion size. Fiber is an essential part of a healthy diet. Fiber aids digestion and can help to control your blood glucose levels. Fiber is found in pulses, beans, oats, whole grain breads, and cereals. It is also found in fruit and vegetables. Try to have at least 5 portions of fruit and vegetables a day. To gain a healthy amount of fiber, eat at least 5 portions of fruit and or vegetables per day. Drink at least 2 liters of water per day. Foods eaten on Shabbos usually differ to foods eaten during the rest of the week, but are similar on each Shabbos. It is important to try and keep a balanced, low-fat diet on Shabbos, as this amounts to 14% of your year. If you have problems controlling your blood glucose levels on Shabbos, contact your diabetes specialist. During the Jewish year, there are several religious festivals, some of which involve fasting. For people with diabetes, fasting can be problematic. Fasting may cause dehydration or hypoglycemia. People who take insulin for their diabetes should speak to their doctor or rabbi about the shiurim rules for fasting. People treated with diet or tablets should speak to their diabetes specialist about any changes to their usual routine. Alcohol can be consumed as part of a healthy diet in moderate amounts. The recommended amount of alcohol per week is 14 units for women, 21 units for men. Always eat some slow-acting carbohydrates when drinking alcohol. Alcohol on an empty stomach can increase your chance of hypoglycemia or low blood glucose. If you use grape juice instead of wine, try to have a small glass only, as grape juice contains a high proportion of sugar. In summary, eat regular meals. Try to have 3 well-spaced meals per day. Choose long-acting, low to medium glycemic index carbohydrates. Eat at least 5 portions of fruit and/or vegetables per day. Try to cut down on high-calorie and high-fat foods and snacks. Drink plenty of water. Use food labels to compare foods. Kosher foods are often imported, and their labeling may not be as clear as food packaged in Europe. To find out the contents of kosher foods, you may need to take a trip to the supermarket and compare labels on equivalent foods. When you were diagnosed with diabetes, you should have seen a dietitian. A dietitian is a health professional who specializes in dietary advice. For more specific advice for your lifestyle and circumstances, ask your GP for a referral to a dietitian who will be able to give you more detailed advice.